Hey everyone, so today is a very exciting video. I'm going to be taking you through my breast enhancement journey. I'm going to be sharing with you the reason that I chose to do this, how I chose my doctor, the healing process, what I thought about it, what I learned, and kind of everything in between. I did vlog a lot of the process, so I have some clips and stuff I'll throw in as I go, but I want to talk about how I actually got to this point. So I am going on my 3rd month post-op, which means I had my operation or surgery almost 3 months ago, so I'm really nicely healed, and I feel like I have a good kind of judgment on everything, and I thought I would share my experience. This is to help other women that are interested in this or that maybe want to have a similar surgery. This is not at all to be an advocate for plastic surgery. I'm not telling anyone they need to do anything or there's anything you need to change about yourself to fit a certain beauty standard. I'm a huge believer in letting women do what they want with their own bodies. I don't shame any other woman for the way that she wants to look or the aesthetic that she likes. So I'm asking you to please do the same in my comments. I want you to be respectful and understand that this is supposed to be a resource for other women to use. So if you are against plastic surgery, you don't want to watch this video. I have over 1,000 other videos that may be more suited for you, but this is about my breast enhancement journey, so that's what I'm going to be talking about. It's going to be a lot of talk about boobs and everything, so if you don't want to watch that, you don't need to, and you can click out now. Here is your warning to do so. So with that being said, I'm going to go ahead and jump right in. So like I said, I am going on my 3rd month post-op, and I feel like I'm pretty much healed. Everything is pretty settled. I have a good view of my scars and how everything looks, so I thought this was a good time to kind of talk you through my whole journey. I have gotten some questions on Instagram. A few of you have noticed that I already went ahead and went in with the surgery, so I want to just talk about why I chose to do this first of all. So the first thing is, for me, something that I think needs to be stated is that when a lot of people heard that I was going to do this, they were questioning why I would want to make my boobs bigger, having that they knew I already had large breasts to begin with, and that is true. I did naturally have pretty large breasts after I went through puberty around 13, 14, so like for the past 10 years of my life, I had fairly large natural breasts, and I don't think that they looked bad. I think they actually looked pretty good in clothing and in swimsuits and bras, all that kind of stuff. What I wanted to mainly address was the shape. I did recently lose some weight, about 20 pounds. At my heaviest, I was about 20 pounds heavier than I am now back in February, and since then I've been losing that weight, and I finally got to a point where I was really satisfied with my body, super happy with the way that I looked, but I felt like my breasts lost fullness, especially in the upper parts, and the shape and the roundness to them was not there anymore in the way that I wanted it to be. So for me, this was a very cosmetic thing that I was unhappy with. I don't at all think anyone needs to change the shape of their breasts, or it's something you have to do or feel pressured to do at all. Again, this is for your own personal journey, and I think it's so important to kind of figure out aesthetically what you want to look like and what's important to you. The look that I like may not be what you want to look like, and that's perfectly fine. We don't need to look the same, and I think that's something good to consider. But I do think that it's slightly misinformed to think that getting a breast enhancement of any kind, whether it be an uplift or a reduction or implants or an augmentation, to think that that only means you have to go bigger. A lot of people go in and they reshape the breast, and that is a whole different process that then you can also add an implant in. And the interesting thing is for me, honestly, I think my breasts are pretty similar size they were previously. The only thing that is different is I am thinner, I have lost weight, so I feel like I'm smaller as a person, so they might look a little bit larger, and then obviously there is an implant, so they have a roundness to the top that they didn't have before, especially after losing the weight and kind of losing that fullness. So I wanted to just kind of get that out there because that is the main question I've gotten, is just why would you get your boobs done if you already had big boobs? And like I said, my main thing that I wanted to address was actually the shape and the way that they looked. I was okay with the size, I just wanted to fix kind of aesthetically the way they looked in clothing. And like I said, you know, with a bra and everything, I feel like they looked good. I was more concerned about what they looked like without one and the way that I wanted them to sit, the roundness, the highness, the perkiness, all that kind of stuff. Also for me specifically, I think I wanted a more fake look, and I'm saying that only because I know a lot of girls that get their breasts done, they want to look as natural as possible. They don't want anyone to know that they have implants. They want it to literally be undetectable, and that is perfectly fine. You can totally do that, and I think it's really down to what you want. Me being someone that lived, you know, the last 10 years of my life with large breasts, you know that if you have naturally large breasts, they look different than fake large breasts do. They're just shaped differently, they sit differently, just all of that kind of stuff. They're not really comparable, they're completely different. So for me, again, the shape and kind of the way that they looked was more what I was focused on addressing, and that's why I brought those concerns to my doctor, and he was able to talk me through what my options were and what would work best for me. So prior to going through with my enhancement, I did so much research, which I think is really important. Knowledge is power. You obviously should be well informed about this. You should really think it through, understand the complications and the risks that are there with any surgery, and just also make sure that you're finding a board certified plastic surgeon. You want someone with a lot of experience, that has a lot of before and afters, really good reviews, and someone that you mainly feel comfortable with. For me, I had a few other consultations to go to, but I went to Dr. Franco at More Beautiful You Plastic Surgery here in Austin, and I was just immediately blown away by the way that I was treated by everyone, the staff there, all the girls working in the office, and then of course my doctor, Dr. Franco, and I just knew that it was the right place for me to be. I knew I was in the right hands. They really listened to me, made me feel very comfortable and just welcomed, and having a consultation can be a little bit nerve-wracking. You're going to go in and you're going to be, taking off your bra and showing them your breasts so that they can look at you, examine you, and then kind of talk through what you want to change and what you want to achieve. And just the idea of that, I think, is pretty scary for some people, and kind of getting over that first step. Obviously you need to have a consultation so that they can tell you what your options are and the ways that they can kind of help you enhance what you're looking for. But it is really, really important to feel like you can be open and honest and discuss the things that you're worried about or the things that you want to work on, because you have to be as honest as you possibly can so that they know what to do for you. It's also really helpful to bring in photos. So if you find photos of other women's breasts that you like, the look, the kind of aesthetic that they have, maybe the way that they fit their frame, that's also really helpful. Something that is interesting is I get a lot of questions about the CCs that I went. I'm not going to disclose that only because it doesn't actually really help you that much. And I promise you, looking at someone's online and seeing the CCs and then trying to compare it to the way it's going to look on your body, that can be a really tricky ball game, and that's what your plastic surgeon is going to help you with, because understanding the way something's going to look on your body has so many factors. It depends on how broad your shoulders are, or how narrow your shoulders are, how much breast tissue you have to begin with, or if you have none, if you are heavier or thinner, if you're taller, shorter, if you have a smaller waist, or you have wider hips, or you have a butt, or you don't have a butt. In order to look proportioned, there are so many things that need to be taken into account. So me just saying the size that I went isn't really going to help you out all that much. But I will say the bra that I wear now is a 34D, and I think I'm a full D for sure. I went ahead and got the high profile gummy bear implants. So they are nice and soft. They're definitely not rock hard, but they do sit really nicely, which was the main thing I was wanting. When I went into Dr. Franco's office, actually I did film a little clip of this. He has a thing up on the wall. It's basically a map from the entire world, and they have pins in it from different people, patients that have come to him from all over the world. So that is really a testament to how much skill he has, how much an eye he really has for the female form and kind of the beauty and all that goes into it. And I knew that that was really just a testament to his incredible work, that people travel from all over to have their surgery with him. And if you are interested in booking a consultation with him, having your surgery with him, I will go ahead and leave the More Beautiful You website as well as their phone number and their Instagram. You can also DM them if you would like on there. And they do consultations over Skype and FaceTime. So if you don't happen to live in Texas, but you want to kind of assess what's going on with you and see what your options are, that is a really great option for you. I'm also a huge fan of their social media because they actually post a lot of their surgeries on their Instagram account. So if you're not queasy and you think you can watch, someone getting a little cut open, it is very interesting and informative to actually see what's really going on. And I watched a ton of those videos before, obviously, I had my surgery, just to kind of be prepped and be prepared and understand what was actually going to be taking place. And like I said, I think knowledge is power. So just understanding what's happening, I think, is always helpful. Hey guys, so I just arrived at More Beautiful You Plastic Surgery. I'm here in the room that I'm going to be getting changed into for my consult with Dr. Franco. So we're going to talk about what I want, my desired results, and then I'm going to kind of see what my options are. So I definitely will be taking you guys along with me in that process, showing you how it goes and showing you that it's really nothing to be nervous of. I know a lot of people get nervous about the consult and how that all goes, but I think it's going to go really well and I'm very excited. Alright, so when you come here, here's the exam room. It's really cute and beautiful. They have this nice big mirror for you and everything. So this is where I'm going to be meeting with the doctor, and we're going to go over what I want and kind of my desired results and see what he can do for me. As you guys can see, there are actually some implants right here. So it'll definitely be interesting to learn a lot about what my options are and what I'm gonna do. So here are my garments that I'll be changing into for the consult, just so that they can get a good look at my breasts and what I want to achieve with them. I know this bra, they're probably gonna place some implants in there so I can kind of see what it will look like on my frame and get a good idea of what to expect. Alright, so I've changed into the gown, so we're going to do the actual consultation now, where he's going to take a look at my breasts and see what my options are, and kind of play around with some sizes and the implants and see them in a bra and everything, and get a good idea of what it will all look like. Alright guys, so I'm here with Dr. Johnny Franco.
How are you?
And we put on, so is this a sizer bra, or how would I explain what this is?
Yeah, so you got sizers in. So we just got it's a bra and tank top, but then we have a little sizing kit where we've just tried on a ton of different sizes here. So you got 400s in right now.
Okay, and I think we like this. We looked at a few different ones. We definitely went up and a little bit down, and I think we kind of landed somewhere in the middle, which I think is good. He said it's important to obviously look at the overall look, kind of going with your body shape. Obviously, I like to look curvy and have those curves and stuff, but I think this is a good balance between having large breasts, but like you said, also being able to kind of, if I didn't want them to be so much out, I could also play around with that. So I'm pretty happy.
Just down.
Yeah, I think that's a good motto that you have, for sure. So I'm pretty happy with this size, and I think this is what I like. But he said with that we will probably go through it once again, just because people's minds can change. I
think the first time you see stuff, it's almost a little bit of a shock, and so I think sometimes it's really hard to get a feel for it. We just find that when people do it more than once, they tend to be extremely happy long term, because now they've thought about it. It's not just the shock value. You've kind of like got something in your head, and then you can re-look at it, and it's less of a shock value. And you're like, okay,
right,
get home into what I really like.
For sure. And I think with a decision like this, obviously you want to be with someone that knows what they're talking about, really makes you feel comfortable with the whole process. And
because it is a process.
It is definitely a process. And I think a lot of people, just this part of actually, removing the clothes, trying on the bra, that can be the intimidating part. Obviously, if you're coming in with an insecurity about some part of your body, it can be a little bit nerve-wracking to hear what someone has to say about that or the solutions they would have. But it is important to have this because you're able to assess what would work best for me versus someone else. And it is a very personal thing.
And help guide you on what we can or can't do, because I think that's part of it is, one, helping guide you with how much time you need off, how much, help you need and so forth, so people can heal well. And then also knowing like, hey, this is doable or this isn't. And I think that's super, super important.
Yeah, that's really great. So I feel really good about this. I feel very confident with it, and I'm really excited to take you guys along on the next part. So as far as the actual surgery, obviously after my consultation, I did try on the actual implants and I tried to figure out the size that I wanted. I think I sized about 3 or 4 times, which is really good. Dr. Franco is really thorough about that because he said a lot of people come in thinking they want a certain size, then they change their mind, then they feel like they want to go back. So it's really important to make sure that you think it through, you go home, you come back to your next appointment, try on the sizers again. Even before you go into surgery, you can try them on and make sure you like the way everything looks. I'm really thrilled with the size that I went. I'm glad that I didn't go any bigger, and I'm glad that I didn't go smaller. But again, Dr. Franco is so just well versed in this. He's done so many different breast augmentations that he knows what to do, and he really is a great kind of eye for this. So if you can't decide on a size, he can help you along the way and kind of give you suggestions while still letting you make your own decision, but kind of giving you some helpful tips, because I do think at the end of the day, obviously a surgeon knows a little bit more than you and I do about this kind of stuff. And yeah, I just felt really good about the size that I have. I do have to say, when you try them on, you'll have like a bra and you'll kind of insert the implants. It's going to look a little different, obviously, than what it's going to look like when it's actually in your body. So that's a good thing to kind of keep in mind. But I think, figuring out the size that you want is important. Having those aesthetic goals is something that you really need to kind of hone in on and figure out. And a big thing that Dr. Franco told me was to bring in photos of breasts that I liked, looks that I liked. Because yes, there are some people that want theirs to look as natural as possible, virtually undetectable, and other people, want that more round, high, I guess, fake look, which was kind of what I wanted, because I had gone so many years with my natural breasts. And as I said before, if you have naturally large breasts, you know that they sit differently than like really high fake ones. So I don't know, that was my personal aesthetic that I wanted to achieve and that I was able to do. So on the day of surgery, I went in and I was a little bit nervous to be put under for the anesthesia, but it honestly wasn't bad. My nurse was so sweet. She actually numbed my veins before they put in the IV, so I was really comfortable. I was just relaxing. Dr. Franco came in, he marked me up. Again, we went over the size and everything, and then they wheeled me into surgery, and I literally remember like the lights going dark and I was under. And when I woke up, I had my surgical bra on, and I remember I wasn't in any pain. My mouth was kind of dry and stuff, but that's really normal. And I was just a little bit like groggy. Like I remember feeling like as if I had taken a really long nap and I was like woken up kind of abruptly. Hey guys, so it's about 6 a.m. I had my surgery yesterday, and I feel pretty good. Haven't really gotten to take a look at them, but I can feel that they're in there. The surgery was so great. I honestly don't feel bad. I'm just a little bit sore and a little tired. So today I have my post-op appointment with Dr. Franco. He's probably going to take a look at everything, make sure it all looks good, but I think it definitely does. I have like a surgical bra on, and then I think like some foam or gauze or something in there. So my throat is a little raspy, I think from the anesthesia and everything, but I feel pretty good, and yeah, I'm just super excited to see them. But the pain was not a problem for me at all. My recovery honestly was incredibly smooth and simple, and I think that is because I really took it easy. I did not rush my recovery. I didn't try to push the boundaries. I am a rule follower through and through. I have always been like that even when I was like a little kid in school. I just listen to the things that people tell me. So when my doctor told me to wear my surgical bra, to not lift anything heavy, to make sure that I was really careful not to split my incisions and stitches, I listened. And I think that honestly is the reason that I healed so nicely, because I didn't try to rush it. I didn't try to go out the next day and like show off my boobs. I just took it easy, let my body relax and heal. And I'm so glad that I did that, because my results are amazing and I'm so thrilled with them. But like I said, I think a lot of that is because I really listened to everything I was supposed to do, which again, also everyone at More Beautiful You, the patient coordinator, Lindsay, she was so thorough and helpful about explaining everything that's going to go on, how it's going to feel, what you need to have to be prepared. You will need someone with you probably the first 2 days or so. Beyond that, you're probably good, but I mean, you know, it's always better if you can have someone like a sister or a mom or just a friend, or like, I don't know, a warm, inviting female force is always kind of nice, just because, you know, there are things going on with your body, and I think it's nice to be able to have someone that can help you out when you need it. Things like washing your hair and stuff can be a little tough for the first few days, just because you really need to be careful on like your motion, because you will have some stitches and stuff and you don't want to split those open. If you do that, you know, it can have some complications and stuff, and that can also affect the way that you scar and all that kind of stuff, and no one wants that. As far as the pain, I was off my painkillers probably in about 5 days, which is pretty good. That's pretty quick, I think. And honestly, again, I just really was resting. They did post a photo of me on the Instagram page for Dr. Franco, and I remember it was 1 week post-op, and people were like, oh my gosh, like I'm so surprised, like you look great 1 week and like you're up and whatever. Now I took that photo just to be able to look at my breast, but then right after I put my surgical bra back on, I did not skimp on that, and this is what it looks like. It's not the cutest thing, okay, but it's very soft, which is good because you don't want anything rough, like any underwire right where your incisions are. And then it also is going to clasp in the front, and you're gonna have this on when you come out of surgery, so it's already going to be on you and everything. And the reason that that clasp in the front is so important is because you're not lifting your arms and doing any straining motions that again are kind of gonna affect your implants when they're first put in. As far as pain, the one thing that they told me was that more than actual pain, it would be kind of a tightness feeling in my chest, maybe even a little bit of like a muscle spasm, and I did have a medication for that. And I remember when I heard that, I was a little confused on how that would actually feel, but that is very true. I think that was more of the pain than actual like sharp hurting pain. It was just a tightness kind of feeling on my chest, but that definitely went away within like the first 3 or 4 days or so. And then from then on, again, I was just very, very careful with all the motions I was doing, and I think I healed really nicely. As far as the scarring, so for me, my scars are really, really not bad at all. Now again, I think that is because I think my skin doesn't scar super bad. It is pretty personal. I know some people scar a little bit, you know, worse and deeper than others. Personally, I don't have that problem, which which is nice, but I also have been religious with using my scar cream. I put it all over my incisions, and then I also use these advanced silicone scar sheets that are really great, and I think these have definitely been a huge reason why my scars look so good, especially, you know, almost 3 months post. It's not that long and they look really, really nice. For me, a big reason on why I didn't want to do this was because of the scarring. I was kind of nervous about that, but honestly, for me, the trade-off, it's just not even equal. Like, to have a scar or to have beautiful boobs that look the way I want, like, it's so worth it. And that was another thing about More Beautiful You plastic surgery, why I chose them, because when I went in and I talked to the other girls that worked there, a lot of them actually have had their breasts done, and they were open with me about the process and about the scarring. A lot of them showed me the before and afters, kind of helped me with sizing and stuff, and I think that was just so helpful to kind of have, you know, that one-on-one interaction with someone else that had gone through the similar thing, and it was just a really warm and inviting feeling. And again, it was a big reason why I wanted to definitely make sure that I did my surgery with them. Now, I want to address the breast implant illness. I personally have had no complications. I know that's kind of a hot button topic right now, and I don't really have room to speak on it just because I haven't experienced anything similar to that. I will say though, I did ask my surgeon about it, and he said that, you know, it's a little difficult to kind of speak on it just because a lot of the symptoms are so broad and they range so far, and there's not a ton of really evidence backing that up right now, but they are definitely researching it. But like I said, I've had no problems, and I do have a high profile gummy bear implants, and I don't know, I mean, I'm really happy with it. And I also did a podcast called Plastic Surgery Untold with my doctor, Dr. Franco, as well as someone that does the anesthesia and someone that's a bit more versed in fillers and Botox and injectables, all that kind of stuff. And we did a whole episode about my breast enhancement and augmentation. So if you guys want to hear about that and learn more about it, I will link that episode below. You can check it out. But we do talk a little bit about the breast implant illness and all that kind of stuff, and then also the different types of options based on what you want to do with your breasts, the look that you're trying to achieve, and what your real goals are. So again, I'll link that below if you want to check it out. I think it's pretty informative, and it just goes a bit deeper into my story if you are curious about that. So my final thoughts are, would I do it again? And absolutely, I would do it again in a heartbeat. The main thing that I think of is like, why didn't I do this sooner? But honestly, it was the best at the timing because I was at the weight that I'm at, that I think I'm stable at. I'm not going to gain any weight. I feel really happy with my body, and I do think it's important to be at a weight that you are comfortable at, because if you gain and lose weight, that will affect the way that your breasts look, and that will affect your results with your implants as well. So try to be within the weight range that you want to be before you do this. That's just a really great way to ensure that your results are the way that you want them. And yes, I would absolutely 100% do it again. My whole experience with Dr. Franco was incredible, and I have no regrets at all. It was honestly very, very simple and just really enjoyable, and I'm just so thrilled with the way they look. I think they look amazing, and I'm really, really happy. And at the end of the day, if you don't like them, that's okay. It's my body, my boobs, and I'm really, really happy, and I'm glad that I did it. And if you're interested in booking a consultation with Dr. Franco, you can mention my name at Megan Parkin for $100 off a facial treatment at More Beautiful You Plastic Surgery. I think that's a really great way to get into the office, meet some of the girls that work there as well as Dr. Franco, feel really comfortable, and then go ahead and have your consultation. And if there's anything you want to change or fix or just see what you can do, I think that's a great place to start. And I promise you, everyone there at their office is so friendly and sweet, and they just made me feel so welcomed and invited, and I mean, honestly, at home. So I cannot rave about them enough. So that's it for my breast enhancement video. Hope that you guys enjoyed. I did get a lot of questions about this. And again, I hope you understand that I'm being so open and honest to help you guys. I want any girl that is curious about this or wants to go through with it to just know everything that I kind of wish I knew. I feel like I had such a great experience, but it was a lot because of obviously my incredible doctor and the team with him, but also because of a lot of research that I did. So I think it's very, very important that you look into it, you figure out what you want, and you also know that beauty really is more than skin deep, and obviously you can change the way that you look. It's going to enhance your life, but just know that true happiness doesn't come from that. It comes from within, and I think being in a good mental headspace is also super important before you embark on any cosmetic surgery as well. So that's it for today's video. Thank you so much for watching. I'll see you in my next one. Bye.